Good afternoon. I'm Dr. Jas Atwal, Acting Deputy Chief Provincial Public Health Officer. I'm joined today by Dr. Josh Reimer, Medical Officer Health and Medical Lead for Manitoba's COVID-19 Vaccine Implementation Task Force. Today, we are announcing 3 additional deaths due to COVID-19, 1 in Southern Health, Centre Sud, and 2 in the Winnipeg Health region. The deaths announced today are from Monday. As previously indicated, a data reset took place, and that allowed for further checks and balances to be put in place, increased consistencies, and improved regional data. I want to extend my condolences to the families, friends, caregivers, and loved ones of these individuals announced today. The current 5-day COVID-19 test positivity rate is 6.9% in Manitoba and 3.9% in Winnipeg. As of 9:30 a.m. today, 126 new cases of the virus have been identified in Manitoba. The total number of lab-confirmed cases in Manitoba is 29,858. Overall, our numbers continue on a good trajectory, but just because the numbers are improving doesn't mean we can stop following the orders or the fundamentals. Households can designate 2 people, family or friends, to visit a household. Outdoor visits can have up to 5 people only, plus members of a household on an outdoor private property. Travel to and from northern Manitoba is restricted, and non-essential travel is discouraged. Some services are allowed to open and operate at 25% capacity while collecting contact information. People need to stay home if they are sick. You need to continue to wear a mask, wash your hands, cough into your elbow. You need to stay home and self-isolate if you're waiting for test results. If one person in a household is waiting for test results, the entire household needs to self-isolate. We have to keep focusing on the fundamentals to protect ourselves, our loved ones, our neighbors, and our coworkers. The level of success we see during the modest reopening will determine the amount we are able to open as these orders expire. If people are thinking of skirting the orders, you're not only putting yourself at risk, but you and those you gather with are impacting the reopening process. We all need to continue to make these sacrifices in the short term so we can be safe in the long term. As we are continuing to see fewer cases under the current orders, we are starting to examine what those new orders will look like. We have said before, nothing is off the table. That remains the case, and consideration is being given to several options. That being said, we must still remain diligent in how we reopen to ensure we can continue the reopening process. We don't want to open, then close, then reopen again, and go through that cycle. Manitobans' adherence to the orders and the fundamentals will determine the outcome. We will have more information on this later this week. Regarding the variant, there are currently no cases of the British or South African variants in Manitoba. CADAM Provincial Lab has been looking for variants since last spring, and testing there continues. We test in outbreaks, possible instances of reinfection, imported transmissions, and random sampling to keep track of how the virus changes. We have done so in the past. We will continue to do the same. This allows us to understand all strains that are likely to be circulating. I also wanted to offer some guidance on Valentine's Day. It's fast approaching. Some are asking if it is okay for younger kids to hand out Valentine's Day cards. COVID-19 is spread through respiratory droplets that come from a person's throat or lungs when they cough or sneeze, and these droplets can fall on surfaces, thereby sometimes contaminating that surface. However, again, washing your hands before and after handling and opening the cards, as well as avoiding touching your face while handling these materials, will reduce the possibility of transmitting COVID-19. Students need to continue to practice good hygiene while writing and handling the cards and maintaining physical distancing when distributing them. If envelopes are being used, do not lick them. One suggestion for delivery could be that students provide their cards to the teacher and the teacher does the distribution. So lots of people aren't handing out cards all at once. And students, again, wash your hands before and after you touch a card. Big weekend this weekend. Obviously for NFL fans, Super Bowl is approaching. People might be thinking about hosting a Super Bowl party. Although my team, the Dallas Cowboys, are not in the Super Bowl this year, I will be watching, but I will be adhering to the orders. Indoor group gatherings remain the 2 designated people you have chosen to come to your home. No new people should be entering your home to watch the game. Outdoor visits, if you're planning an outdoor gathering, remember it's only 5 people outside of your household. It's going to be a cold weekend. Think about that. The fundamentals apply to these outdoor gatherings as well. Wear a mask, physical distance, wash your hands, and cover your cough. Even having your 2 designated people over in your home, try to physical distance. It is possible to do. Continue to try to do that. Most importantly, don't attend indoor or outdoor if you are sick. Football might be any given Sunday, but let's have it be a COVID-free Sunday this year. Now, we have been made aware through conversations with our trucking industry, our essential workers who provide goods and services to Manitobans, the food that we eat on our table, that they're being denied some essential services. Services such as even accessing washroom facilities. This is disappointing to hear. We rely on this industry to provide the goods and services we use every day, and we likely take these services for granted. They offer a vital service, and for them to be treated like this is unacceptable. To the businesses that are turning truckers away, I ask you to open your doors and make these facilities available. We are friendly Manitoba for a reason, and I ask you to show the friendliness towards these essential workers. Let's show humanity to people. While I encourage Manitobans to stay home as much as possible, donating blood is still very essential, and donations are always needed. Please consider booking an appointment through Canadian Blood Services to donate blood and to save a life. Thank you, and I will now pass it over to Dr. Joss Reimer.
Thank you, Dr. Atwal. Good afternoon. I'm Dr. Joss Reimer, the medical lead for Manitoba's Vaccination Implementation Task Force. Earlier this week, I was joined here by my colleague, Dr. Marcia Anderson, who provided an update on the immunization campaign for First Nations. Our partnership with the First Nations Pandemic Response Coordination Team is a critical part of the vaccine rollout, and I just want to take a moment to again thank Dr. Anderson for being here on behalf of her team and thank the entire team for their great work. In total, Manitoba has allocated more than 11,000 doses to First Nations priority populations. The province is also putting plans in place to immunize people in Northern Affairs and other communities in coming weeks. Recognizing the disproportionate effect that COVID-19 is having in the North, this is essential. This week, we celebrated the launch of our first super site in Thompson, which I know was really welcomed by the community. And we look forward to launching Vaxport in Thompson soon when supply allows. So a very limited supply of vaccine continues to affect all that we do in the immunization campaign at this point. All first dose appointments available in Thompson, Flin Flon, and the PA have now been booked. All appointments in Winnipeg and Brandon super sites are for second doses only at this time. Some of my colleagues from the task force provided an update earlier this morning to media, and one of the charts, which is available online for all Manitobans, shows the effect of this disruption. From February 15th to 17th, we have to pause operations at the super sites in Winnipeg and Brandon. This is because we do not have enough doses to continue providing doses on those days. Any appointments scheduled at those times are being rescheduled, but those second doses are still going to be administered within the recommended timeframe. We are communicating directly with the affected people to let them know what the plans are for their vaccination. On a more positive note, our planning and focus on safety over speed continues to show results. Manitoba remains second in the country for the number of people per 100,000 that have been fully immunized with second doses. Sur une note plus positive, nos efforts de planification et l'importance que nous accordons à la sécurité, de préférence à la rapidité, continuent de donner des résultats. Le Manitoba conserve sa place et continue d'occuper le deuxième rang au pays. Pour la proportion de sa population ayant reçu les 2 doses de vaccin. We are also a leader in total doses per capita, only behind PEI and the territories. These numbers show that our planning and our processes are working so that we can protect more Manitobans safely and effectively. As I mentioned, my co-lead on the task force, Johanna Bota, and several others provided an update to media on Manitoba's plans for what we call Q2, or the second quarter of vaccine delivery that begins on April 1st. The presentation is posted online at manitoba.ca/vaccine under Data and Reports. But I wanted to share a few key pieces of information with you today from that. We want Manitobans to know that we are ready. And if enough vaccine comes to immunize nearly every adult in Q2, we can meet that demand. This means that we need to be ready to deliver 1.5 million doses of vaccine, or about 20,000 doses a day. Nous voulons que la population manitobaine sache que nous sommes prêts. Si nous recevons suffisamment de vaccins pour immuniser la presque totalité des adultes au deuxième trimestre, nous pourrons répondre à cette demande. Cela signifie que nous devons être prêts à administrer 1,5 million de doses de vaccins, ce qui représente environ 20 000 doses par jour. Right now, our actual maximum capacity is 7,097 doses per day. But we are planning to open more super sites, reaching a total of 13 located across the province in the coming months. Earlier this week, the province announced plans to partner with doctors' offices and pharmacies to provide immunizations once we have a vaccine that is approved that can be suitable for these locations. That boosts our capacity even further and will help put vaccines in locations that are both familiar and more accessible to more Manitobans. And those plans are complemented by mobile pop-up sites and our focused immunization teams. They can immunize smaller numbers, but it's very significant in their ability to reach targeted groups of people who may not be able to get to some of the other clinics. We are going to begin reporting our daily maximum capacity online so that Manitobans can track our progress towards the 20,000 doses per day. And while you're on the vaccine website, looking at the presentation or the tracking of those doses, I'd also encourage Manitobans to try our vaccine queue calculator, which shows where you are in line for immunization based on your age, vaccine uptake, and a few other factors. This, along with all the information that we have available about the vaccine campaign, is updated regularly at manitoba.ca/vaccine. And finally, I just want to give an update on some of the numbers. To date, 43,318 doses of vaccine have been administered. This includes 32,852 first doses and 10,466 second doses. As of February 2nd, Manitoba remains second in the country in the number of people who have received 2 doses of vaccine and are fully protected against COVID-19 at 759 per 100,000 Manitobans. Every day, we are protecting more Manitobans against COVID-19. Our family members, our friends, our neighbors, co-workers, and people who are part of our communities. Before I wrap up, I just want to take a moment to recognize everyone who's working in our immunization clinics or with a focused immunization team or planning a pop-up clinic or planning Vaxport or doing any of the work in the background. There are just so many people working behind the scenes to make this immunization plan a success, in addition to the thousands of people who have joined the vaccine workforce. Beaucoup de gens travaillent dans les coulisses pour faire de cette campagne un succès. En plus de milliers de personnes qui se sont joints aux effectifs de notre programme de vaccination. Thank you for everything you're doing for Manitobans. Merci à toutes et à tous. And with that, we can take questions.
Thank you. A reminder to our reporters on the line this afternoon, you will have 1 preliminary and 2 follow-up questions. Up first this afternoon from CBC Manitoba, Ian.
Good afternoon, Ian Frey, CBC. Dr. Reimer, I guess the target expressed earlier this morning for Q2 was 20,000 doses a day. How likely are we to actually reach that target?
I would say that we are ready to reach that target. We have a staffing plan in place. We have teams who are working diligently behind the scenes to make sure that the clinics are all ready to go. So really the deciding factor of whether or not we can achieve the 20,000 doses a day is if we have 20,000 doses a day. But the teams are working really hard and everything is going smoothly to be able to open up when we get more doses.
Okay, thank you. Manitobans can get the flu shot at virtually every doctor's office or clinic in the province. Now when we are talking about the rollout for the COVID vaccine, why leave it up to doctors and pharmacists to volunteer? Why not give these vaccines to everybody?
So we're actually using a very similar process to what we do with the flu campaign. So doctors and pharmacists need to volunteer to participate in the flu campaign as well. They need to register with Manitoba Health so that we know who to ship vaccine to and how much to ship to them. So the process for who decides to be involved is very similar. There are some differences because there are some differences in how we have to manage this vaccine. We're wanting to do much more detailed inventory assessments, for example. So there'll be a new web form that physicians' offices will have to fill out, and the pharmacists will be entering directly into our public health information management system. So it is a little bit more difficult because of some of the logistics and our desire to really control the supply more carefully than we do with flu. But beyond that, it is a very similar process to our flu campaign, and we are looking forward to receiving those expressions of interest from all of our usual clinics and pharmacies.
As well, Dr. Reimer, the daily vaccination estimates for February are a few hundred lower per day than they were in the briefing last week. And then April, of course, hoping to get to 20,000. What are we anticipating for the month of March?
I don't have the March numbers in front of me, and in fact, we don't have up-to-date estimates from the federal government or the manufacturers on March. So we did previously have March was included in the estimates that were sent to us from the federal government. Since the Pfizer and Moderna disruptions occurred, they've actually removed those estimates in the data that they sent to us. While I don't have even our most recent estimates in front of me, and we can get that to you, we don't know at this point what we'll be getting or when compared to what we thought we knew previously.
From the Canadian Press, Kelly.
Hello, thank you. How much is Manitoba counting on other vaccines receiving approval, considering that Moderna and Pfizer's supply chain for Canada isn't really looking to be stabilized by March?
So that's a great question. Vaccine supply chains are always unpredictable. And we expect that other products that get approved will also be unpredictable in their supply. So the more products that we have available, the easier it is for us to get through supply disruptions for each individual product because we have other products that we can turn to. So what we've done right now is we've used the estimates that we're getting from the manufacturers and the federal government to produce low supply and high supply estimates. The low supply estimate is based on the currently approved vaccines. The high supply assumes that we're getting 700,000 doses of future approved vaccines, probably AstraZeneca, but we know that the Janssen & Johnson product as well as Novavax have also begun their submissions to Health Canada. We'll be ready to provide Manitobans with whatever vaccines are made available to us. But if we want to reach all Manitobans by the end of August, we will need more than Pfizer and Moderna to be approved.
So considering the numbers in the north right now, if that trend continues, will there be a prioritization of getting more of the vaccinations to those super sites, say in Thompson, if more of the vaccine becomes available, considering Winnipeg's numbers are now stabilizing?
So we're definitely keeping our eye on the epidemiology and the numbers as they change. I would say that we need to make plans long in advance of what's happening with cases. And the cases can change rapidly. So while the north is having higher cases today, next week there might be an outbreak in a community outside of the Northern Regional Health Authority. So it was very important to us to make sure that Thompson opened up even with the disruption in the Pfizer supply, which is why we moved Moderna to Thompson. To enable access, first off, to people who are already eligible in the north, but also in response to the fact that the numbers were higher in the north compared to the rest of the province. But we additionally need to make sure that we have this available throughout Manitoba. The vaccine doesn't treat an outbreak. What it does is prevent cases from happening. And so it's important, even in communities where there are no cases happening right now, to get access to the vaccine so that we can keep it that way.
I'm not sure who's best to answer this, but how much are these inconsistencies in vaccine supply shaping the plans for reopening or lifting restrictions?
Yeah, great question. The vaccine supply really isn't impacting decisions made regarding restrictions. I mean, we still look at cases, we look at hospitalizations, ICU usage, test positivity, et cetera. We look at the epidemiology, in smaller regions and in larger areas as well, like the whole province. With the small numbers of vaccine that are available right now, it has no impact in relation to how we look at the orders. Again, it's a nice protective measure to have to get, again, having those PCH residents vaccinated. It does provide some security there, but it doesn't impact, I think, how we look at those orders at the present time.
From CTV Winnipeg, Michelle.
Hi, this question's for Dr. Reimer. With doctors and pharmacists, it sounds like you're just going to have them vaccinating people inside their clinics. Why not also use them for vaccinating people in assisted living homes or people maybe with disabilities living in the community? It just seems like that's such a massive population. There's so many seniors living in these homes. And using the fit teams, it might take a long time to get to all of those people.
So I would say that there's nothing is off the table. And both physicians and pharmacists can currently also apply through the application process. And there's also a contract process to participate in our super sites or our fit teams. Right now, we don't have a vaccine that we can take to people's homes. Both Pfizer and Moderna are very sensitive to physical disruption. And if they're shaken too much, for example, the RNA can clump and become less effective. So for today, we don't have a vaccine that we can do a door-to-door campaign with. But as we go into the future, all of those options are on the table. We want to start with where we already have proven effectiveness in our flu rollout. So that's the clinics that we know every year provide a vaccine to Manitobans. But that doesn't mean that we'll stop there. That just means that that's where we want to make sure that we start because we know that that has proven effective in the past.
And what do you think how likely will it be that we do get this third vaccine in Q2?
I mean, I can only speculate on the likelihood of getting the vaccines. Certainly, we're hearing from the federal government that they're anticipating approval of AstraZeneca in the near future. When exactly that'll be, I don't know. And we're hearing that, we're expecting that the manufacturer will have doses available for Canada coming in Q2. But likewise, AstraZeneca has expressed that they're having some manufacturing delays as well. And the European Union is currently working with them on that. So the best information that I have today is that we will have a third vaccine available in Q2. But we know that that's unpredictable and that can change any day.
I just wanted to re-ask something I've asked before. Will there ever be any ability for Manitobans to choose which manufacturer they get, or is it just a matter of situation?
So for now, the two vaccines that are approved are being treated as equivalent. And so there's no opportunity for Manitobans to choose which product because different products are offered in different locations. As the product groups expand, that's something we would have to look at and make some decisions around the best way that people can access. But no decisions have been made around whether people would be able to choose a specific product. And that decision needs to be made depending on which products are approved, in what quantity, and when.
From City News, Mark.
Hi there. There's been some requests from doctors in the province to issue some type of vaccination card at the immunization site to alleviate a potential rush for people seeking that document if travel opens up or sporting events resume. Can you just speak to what the province is thinking is on doing something like that?
Sure. So we recognize that while right now there's no rules that get amended if someone's received a vaccine versus not received a vaccine, we know that that may happen. Other countries may have different rules. Events may create their own rules. And so Manitoba is currently working on a few different options. And no final decision has been made about which direction we'll go, but we are looking at an online option similar to the COVID-19 portal where you can get your results, that there could be something similar to that for getting your vaccine status. We're also looking at a card system where we would have something that we could send to Manitobans so that they can verify whether or not they've received the vaccine. One of the challenges, and that we're trying to take the time right now to get right, is making sure it's something that will be accepted and trusted and will be secure. So rather than a piece of paper that anybody could write down on what vaccine someone had, we're looking through our different mechanisms to see if we can do something that will be secure, that's very difficult to tamper with. So that's where, we're taking this time right now to make sure that we get the best possible option available for Manitobans. And as soon as I know which one that is, I will absolutely let you know.
Thank you. And you kind of talked about it there, but, do you think it would exist like at the level of security for a driver's license? Do you think it'd be more like a passport? Is it like a health card? I know you kind of covered that, but can you talk a bit more about maybe what it would look like or what the top contenders are for it right now?
Yeah, I certainly have heard them talking about something that looks like an identity card of some sort, but I don't have any of the details about whether where that planning has gone. But we can certainly check with the team and get an update to Manitobans in the near future.
Okay. The only other question I had was you were saying earlier that Manitoba is second in the country. I didn't quite hear if that was in terms of vaccines distributed or where we were doing so well. Can you just reiterate that or talk a bit about where we're second in here?
Sure, I'm happy to reiterate when we're second in the country. That's a great question. So the data that we're quoting is people who have received both doses per capita, so per 100,000 Manitobans. So PEI is the only province that is ahead of Manitoba in the number of residents per capita or per 100,000 people who have received both doses. But I will say also that we're only behind the territories in PEI when it comes to total doses administered per capita as well. So both of those measures, we are a leader in the country.
From CHVN, Taylor.
Hey, good afternoon. We've been told directly from staff that work in school divisions that they aren't being allowed to work from home despite the fact that it's not going to make an impact on their work. What's your messaging to workplaces who aren't letting their staff work from home in these kinds of situations?
Just can you repeat the beginning of the question? Were you talking about schools specifically?
School divisions, so staff who work in school divisions.
So I think our message in relation to staffing and businesses is, if someone doesn't need to be in a location, a separate location, or if they're able to work remotely, we would want them to work remotely and to be able to accommodate that. If they aren't able to do that, then to make sure that work environment is safe. I think that has been our messaging all along.
And along the same lines, we're seeing our cases lowering. What if someone wants to start working from home or even go back to the office? What's the advice for that?
Yeah, that's a great question. So right now, with all those restrictions that we had in place, our case numbers are down quite dramatically. I think when you look at Winnipeg, we had 32 cases this morning in the Winnipeg Regional Health Authority or yesterday. So our case numbers do flux still, right? We're going to have lower numbers. There's going to be ebbs and flows, and for a lot of individuals, sometimes it takes a bit of time to transition from a home environment workspace to a true workspace in a building or a facility at a designated workplace. So I think for the time being, we're still in a pandemic. The pandemic isn't going away. We're going to see our case numbers rise. We are expecting that as well. If you are able to work at home, I think you should continue to work at home. If it needs to happen that you have to go into a workplace, again, that workplace should be safe. And I think what works best with the employer and the employee should be what is done. So I think a lot of that work has already been done.
And I know this is a little more into the future, but when can people expect a bit of a back to normal for workplaces?
Yeah, that's a great question. So, we've talked about, our acute care system, the impacts on the acute care system with the number of cases generated. We're talking about vaccines as well, but we're also talking about supply disruptions and vaccinations. It's really hard to predict the future. I think, month by month, we'll have better indicators in relation to when some normalcy resumes, let's say, in workplaces, the way it was at before the pandemic. So it's really hard to speculate on the future. I think for the short term here, for the next few months, though, I wouldn't expect much of a change. Just knowing how the vaccine supply is a bit of an issue right now, getting the vaccine into Canada. And also we realize that we're still going to be generating cases even when we are, providing vaccines to individuals as well. So it'll be a few months for sure.
Thank you.
From the Winnipeg Free Press, Dylan.
Hi, doctor. Thanks for taking our questions today. Dr. Atwal, I'd like to know about the epidemiology of the northern cases and how long we expect them to stay high. If you have specifics, I'd be curious to know if you're seeing trends in the individual districts, if they're all sort of stable or rising, or if any of them are in decline. And if you don't have specifics, just if you have any estimate for how long we're expecting these northern cases to stay so high.
Yeah, that's a great question. The Northern Health region is a vast region. There's lots of communities, from the east to the west. It's a very big region for sure. There's some remote isolated communities in that region as well where we're seeing outbreaks, which are accounting for a number of the cases there. Thompson is a larger center within the NRHA as well, and they're experiencing a number of cases as well. There's been some ebbs and flows in some of these communities before as well in relation to cases. I think in general, talking to public health on the ground, there seems to be some thought that the numbers are stabilizing, especially where the outbreaks are occurring. So it is encouraging, but there are still a number of cases there on a per capita basis for sure that is out of the norm compared to Manitoba. So we are keeping an eye on it. We are seeing a lot of household transmission and close contacts converting into cases as well in those situations. So typically like this, when you're looking at a large number of cases in an area, it will take several weeks for us to sort of see those numbers come down. As you recall, it took a number of weeks for the Winnipeg Regional Health Authority or Southern Manitoba to see their case numbers dwindle on a day-to-day basis or on a week-to-week basis. And then at that same time, we saw that rise in the NRHA. So we are expecting, as things are managed better, not managed better per se, but, we're more involved in that case and contact management and with the adherence. And as cases burn through those close contacts, we should see a decline in the near future, we're hoping.
Thank you. And another question for Dr. Atwal about preventative measures when it comes to the variants. We have some cases in Regina right now of variant cases and in the United States. I'm wondering why we don't have check stops at the Saskatchewan and Ontario borders and what sort of work is being done to enforce the quarantine order, because I know right now there's exemptions for sports teams, for film crews. I'm just wondering if we're looking at curtailing the exemptions and putting up check stops at the border.
Yeah, that's a great question. So, the UK variant, the specifics where you talked about Regina, they were travel related. So someone did come back from international travel, tested positive. I believe it was a close contact who tested positive as well. We have been screening for that to some degree with genomic sequencing in Manitoba. We've been doing that for many, many months. We've ramped that up as well. The federal border is under a federal jurisdiction. So again, there's work being done on the federal government side in relation to having testing done, prior to departure from international, on arrival, 3-day quarantine as well, and then coming into your home destination, and then having some more testing done at that point and sort of enhanced precautions on the federal border side when someone returns. So they're finalizing some of that work. We're going to be finalizing some of our work associated with that as well. We do have those orders in place. So if you are a non-essential worker and you're coming back to Manitoba, that you do have to look at that 14 days of quarantine or self-isolation. So, we have a lot of messaging out there. We have been talking to businesses and sectors about that as well. Really, our messaging is, don't leave the province unless it's essential. period. And that goes for everyone. There are some people who have to do that essential work outside of the province. That is their job. Those individuals are asked to come back and self-isolate as well. So, there's a lot of work being done. I'm not saying everything's set in stone at this point. We're still looking at other tools in our toolbox in relation to that. Enforcement, obviously, because it is an order, it can be enforced, and that ability is there. So, we are, again, looking at this day to day, and we'll see where that takes us. And when, more tools perhaps are going to be used, we will provide that information to the public.
Thank you. And my last question is for Dr. Reimer. I'm going to try a two-parter here. The first part is about the online booking system. It doesn't exist yet. I'm wondering if the phone system can handle 20,000 registrants in a day if we're able to reach that target. And also, how many second dose appointments have had to be rescheduled so far?
So we do have an online booking system that is, what I've heard from the team is it's pretty much ready to go. So I think when we open up, certainly when we get to Q2, we'll be able to use the booking system. Whether or not it can handle the 20,000 doses a day, I think we'll open it up and we will work through any of the challenges with it and make sure that any of those challenges get addressed as our numbers go up. Can you repeat the second question again?
Sure. Sorry. I was wondering how many of these second dose appointments have had to be rescheduled. I know you mentioned some have, but do you have like a ballpark figure for how many?
Yeah, I think I was talking to the team earlier today, and I believe the number that they told me was around 400 individuals. I'll have to take it away to confirm that, but because of the great planning that our team did and really scrambling to use up every single dose available, we really were able to minimize it to only a few days of our appointments having to be rescheduled, and none of them are going to be more than a few days different than their original date. So that means that everyone who booked second dose appointment will still be receiving that second dose within the manufacturer's guidelines. So I really just want to thank the planning team for the really complicated and hard work that they did, ensuring that we had those doses available to everyone who was booked.
From Global News, Joe.
Hi there, Dr. Reimer. I just want to be clear on the 1.5 million doses for the second quarter. Now, is that what you are projecting will arrive in the second quarter, 1.5 million doses, or is that simply what you're prepared to handle?
So from the technical briefing earlier, I believe that the plan was to assume that we might receive that many and be ready for it. We've received different estimates from the federal government depending on which vaccines are included. And so we want to be ready for the best case scenario that we get a lot of vaccines in the second quarter, and make sure that all of those clinics and the distributed model and everything is ready to go to reach Manitobans. So all of our planning right now is based on theoretical numbers, but we're trying to plan for the highest numbers possible.
Gotcha. And do you know roughly when in the second quarter we'll hit that 20,000 capacity level?
Again, I mean, everything that we're doing right now is theoretical. So if on March 1st we suddenly had a huge influx of doses, we would ramp up on March 1st and we would open up new clinics and we would expand our existing super sites and everything, all of the different models that we've discussed in the past would start to open up. If we don't get that big influx on March 1st, we'll be ready on whatever day those doses do arrive.
And I know we've been over the priority groups before and stuff like that, but when we reach that 20,000 a day capacity, which priority groups will we be at? Who will be eligible by that time?
So the plan right now is to do an age-based approach. And when we're looking at our high supply scenario, we'll be able to reach all Manitobans by the end of August. So by the time we hit April, I think we're talking about people who are, in their 50s to 60s, potentially being eligible, again, in the high supply scenario. So that's what we're planning for, our best case scenario, making sure that we have our clinics ready to go. But we also need to realize that it's possible that we won't get a lot of vaccine by that time. And so certainly in our low supply scenario, we're really looking more at people in their 70s being eligible in April.
From the Brandon Sun, Michelle.
Good afternoon. I have a reader whose wife lives at a private personal care home in Brandon, and there's no sign of a vaccine. Can you explain that in light of your personal care home team?
So the planning team that created the schedule for all the personal care homes looked at all licensed personal care homes in Manitoba, whether they're private, not-for-profit, or publicly funded. If they're a licensed personal care home, they've all received their first dose of vaccines. For all other congregate living settings, which includes unlicensed personal care homes, assisted living, supportive living, corrections, shelters, we are working on a priority sequence to send our FIT teams or our focused immunization teams to all of those settings throughout the next month or two.
Okay, so just to follow up on that one, it's possible that it's not literally considered a personal care home? Is that what you're saying?
So what I'm saying is that the initial list was licensed personal care homes. So Manitoba does have a list of all personal care homes that have been licensed with the province, and those were the ones that received the first dose in that initial round.
Okay, thanks. Okay, I've received a couple of emails from readers saying they're not understanding why Saskatchewan and Manitoba's orders are so different. Like, they still get to eat in restaurants, etc. The COVID numbers seem rather similar. Can you explain that idea of side-by-side provinces having a different approach to dealing with COVID?
Sure. I mean, there's we're in Manitoba. We have to do what's best for Manitobans. So, from a public health perspective, we're responsible for Manitoba. The Manitoba government's responsible for Manitoba as well. We're looking to mitigate risk for Manitobans. We had large numbers of cases. We had large number of cases in border towns as well. So we have to take that into account when we're looking at restrictions and orders and the risk to our acute care system. I mean, if you are living close to a border, you aren't going typically to another province's acute care system. You're in our acute care system. Most of your interactions typically deal with the province that you're living in. There are some communities right along the border where there's some movement of individuals across the border for shopping or essential needs, etc. We understand that, and there are exceptions made in the orders for that as well. So, we are looking for solutions for Manitobans. We're responsible for Manitoba, and we're going to continue to be responsible for Manitoba as well.
From CJOB, Will.
No.
Hey, good afternoon, doctors. People are bringing concerns to us about discarded vaccine vials, as in shots that don't go into arms and instead end up being wasted. Dr. Reimer, are you keeping track of how many doses are discarded? And if so, can you tell us how much has been thrown out to date?
So we are carefully keeping track of every dose, whether it's used or thrown out or there's something wrong with it. Every single dose is tracked in our system. And how we run both our super sites as well as our focused immunization teams is we have the immunizers only use the number of vials, one at a time as people come into the clinic. So that means that they're not preparing large amounts of vaccine ahead of time. And if there's no shows to the appointment or people make the decision not to be immunized after a discussion with an immunizer, that doesn't lead to wasted doses because we've only drawn up and we've only punctured the vials for those that we know we're going to be using that day. So at the end of each day at the super site, for example, the most that we could be wasting is 1 vial's worth of vaccine, which in the case of Pfizer means, at worst 5 doses. The manufacturers told us to plan for a 5% wastage, and Manitoba is well below that. We expect that as we expand to more clinics, to smaller clinics, and certainly when we go into doctors' offices and pharmacies, that we're going to see more wastage because there's far more people involved and it's done in a less structured approach. There's going to be more variation in how the different providers manage the vaccine. So we'll certainly give them advice and standards of practice to follow, but we do know there'll be that variation. So we fully expect that our wastage will go up as we expand out. But right now, our wastage is so low, much, much lower than we've seen with previous vaccine campaigns, that even if it expands substantially, we'll still stay well within the 5% wastage as stated by the manufacturer.
Okay, yeah, thank you for that explanation. Can you expand on one point you just touched on there? So what exactly are immunizers told to do with partially filled vials at the end of the day? Like what does that process look like, please?
So I'll speak to Pfizer specifically, just as an example. The Pfizer vial holds officially 5 doses, although in Manitoba we almost always get 6 doses out of it. So at the, let's say the RBC clinic, an immunizer goes and punctures 1 vial at a time. So when they know that they're going to have 6 more people coming in, they go to the freezer, they get 1 vial, they bring it back to their station, and they fill 6 syringes. The reason that they do all 6 is that once that vial is punctured, it's only good for 6 hours. And so we don't have any ability to store those syringes once they're filled up because we need to use it, that half day. But the way that we're preventing things from getting thrown out is by only having each immunizer go and get a vial when they know that they have 6 people coming. So as we get closer to the end of the day, we don't have all of the immunizers filling up all of their vials if they only have 1 or 2 people coming in. We would assign all of those people to the same immunizer so that, again, we're not wasting vials. And at the end of the day, there should be the remainder of 1 vial left, and that amount would be wasted.
Okay, thanks. And kind of just looking into the future here as we're talking about more pop-up sites, getting family doctors and pharmacists involved. Can you tell us a little bit about plans or strategies you have to cut down on potential waste in the future?
So I think we'll be creating advice and guidelines for all practitioners to follow. We're sharing our playbook publicly so that people can see what all of the different logistics and advice and guidelines that our teams are following now are. And we'll work with pharmacists and physicians and all staff at any of our clinics to ensure that the guidelines are clear and that their questions are answered. And we also are doing much stronger inventory management than we've ever done with previous vaccines. So rather than just sending the vaccines to a clinic, for example, and then sending them more when they ask for more, we're requiring all pharmacies and clinics to report back to us what happened to each and every dose, so that we'll be able to track that. And if there's certain clinics that we're seeing are having more doses that are being wasted, we can reach out to them and connect and see where we could assist in reducing that wastage for that clinic.
From the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. Dr. Reimer, first question to you, and this is going back to Ian's question that was off the top. And he asked how likely it was that targets, the ones announced today, would be actually reached. And I don't believe you answered if they would actually be reached. I guess I'm wondering, it's nice to say that we'll have the capacity for 20,000 doses per day. I understand it's difficult to say whether or not those doses will come, but is it realistic for Manitobans to think that will be achieved, as early as starting as April 1st?
Yeah, I mean, it's very difficult for me to answer that question because Manitoba doesn't control the supply. So the planning that we're doing is to be ready in case we get large numbers of vaccine. But as far as whether or not we do, I don't have that information. Really, only the manufacturers know. And even with the manufacturers, there are many unexpected things that can lead to delays. So our estimates are high so that we can make sure that we have all the infrastructure ready. But I'm not really able to tell you whether or not we're going to get all of those doses because the manufacturers are the best ones to answer that question, and even they can't predict exactly what sort of bumps may come along the road.
Thanks for that. I guess a follow-up to that would be that there's, there's dates put on this. You expect to be able to do this by April 1st and into Q2 and that sort of thing. So these dates should more just be read on readiness more than availability, I suppose. Then.
I mean, Manitoba can only commit to what we have control over. So we are sharing publicly what we can do. And if we have the supply, then we will be able to achieve everything that we've put out in our best case scenarios. There's really no way for us to commit to having the doses because we don't control that supply. And so as things move forward, we will consistently be sharing with Manitobans the best information that we have about supply. But right now, we really only have gotten estimates for the next 2 weeks for Pfizer. And we don't even know for Moderna what we're getting next week at this point. We're told that doses are coming to Canada, but we haven't received the estimate for Manitoba yet. So, it's difficult for me to say how many doses we're going to have, but what I can commit to is that we're going to make sure that we are ready to go when those doses arrive.
All right, thank you for that. Dr. Atwal, just wondering, and maybe this has been asked in the past, I just don't remember, but how would the introduction of a variant into the province affect reopening plans going forward, just given what has been said about some of these variants and how more easily they can do in terms of transmission?
That's a great question. So, we're looking for the variant at the present time. We haven't seen that variant here as of yet. From a planning perspective, we're determining what that risk is with the variant. So we are talking to our provincial partners who have that variant. Some of them have changed some of the public health measures that they've entailed in relation to clients with the variant as well. So we're going to be looking at that as well and determining what our next steps would be. In relation to restrictions, obviously if something is more communicable, has the same impacts on morbidity, mortality, hospitalizations, obviously that would impact our ability to loosen the orders if a variant does ever come hold in Manitoba. Again, at the present time, that hasn't been the case. We're putting in greater measures to help protect Manitobans from that variant from coming into Manitoba. We're ready for that variant when it first does come into Manitoba as well from a public health perspective. But again, if we're able to mitigate that risk, then from a planning perspective, it's sort of the same planning that we've been doing in relation to the orders as well. Again, we can't speculate on the future. If that variant does come into Manitoba and by chance, if we are speculating here, it takes a strong arm in relation to being the majority of the cases or whatnot, that would impact, I think, the acute care system, and it would impact what we would do from a public health perspective as well.
Our final reporter this afternoon from CBC Radio Canada, Gavin.
Hello, doctors. Dr. Roussin, first a question for you. How concerned are you about the possibility of the importation of the virus in northern communities with the opening of ice roads? Is the province working on any sort of way to sift the communities to avoid the virus getting into communities that way?
It's a good question. Again, I think I sort of alluded to that right now. We are looking for that variant through our testing. We are advising people not to travel unless it's essential. That variant, again, hasn't been found in Manitoba. Some communities have done some specific measures. Some First Nations communities have some control, a little bit more control over their borders. There's only one road in, one more road out, with the ice road. So they have these check stops that have been put in place, and they are monitoring who's leaving and coming back. Again, we are looking for that virus. Public health is ready if that variant does come. But the communities themselves, the people, Manitobans, need to protect themselves. It's the orders are there as a guide, the orders are there as a law for sure, but at the end of the day, our behaviors is what's going to have an impact on COVID-19 or any variant coming in. Right? So the onus is on all Manitobans to do their part, to take that messaging that public health provides and to adhere to the orders.
Following up on something you said earlier, can you give us any more details on the incident with truckers? What other than washrooms, what sort of services have been refused to them?
Well, so, I think from the beginning of the pandemic, we were involved with the Manitoba Trucking Association. They've had issues, there's this perception of a greater risk with an essential worker as a trucker, traveling through different borders, driving through our American border as well. These are vital people for Manitoba. We need these individuals to bring food, to bring goods to Manitobans to survive. Early on in the pandemic, we had issues, let's say, with doctors' offices even, with them accessing dental services or even with medical services because there was a perception amongst a few of these professionals of risk. So, we did some really strong messaging related to that. We worked with the associations that represented those health professionals as well. Lately, we've heard some issues in relation to accessing bathroom facilities. So we just wanted to really make sure that support is there for those essential workers. These are vital people to Manitoba. There's thousands of Manitobans who work in this industry who bring goods into Manitoba for all of Manitoba. So, let's be friendly. Let's be humane. Someone needs to use the bathroom. Let them use the bathroom. We need to be humane to each other.
And maybe I'll finish on a bit of a lighter note. You provided some advice for children on Valentine's Day. What about for adults? Perhaps some advice for people that are, meeting for the first time and perhaps want to engage in some adult type activities at the end of the night. What sort of advice do you have to adults?
Indoor gatherings, right? Someone in a private residence, it's got to be the 2 designated individuals that are allowed. Those are orders. Outdoors, if we're going for a walk or meeting someone new, go outdoors, go for a walk, try to distance, get to know someone. I think from a public health perspective, there's a lot of conversations we could have about this as well. But stick to the fundamentals, stick to the messaging that public health is providing, and be safe. I think that's the most important thing.
Thanks, everyone. This concludes our media briefing.